So today we're going to be talking about substance use behaviors, understanding the risks, and also we will also be covering ways that you can seek help in the event that there is a substance use uh, behavior or a substance use addiction, really, because substances in and of themselves are not bad. They just sit there. But when they're used and when they're used abusively, then they become a problem. So we're going to take a look at the different ways that we describe a substance use disorder, and then also hopefully some helpful information that can help along the way in the event that someone does have a substance use disorder. Okay, so let's take a look at what are substances. First of all, like I said before, substances are in and of themselves pretty much nothing. They're inert. They just sit there. They are uh, material, but they don't do anything unless we take them and we use them, and we put them into our bodies. Then they become uh, drugs of choice that we use to put into our body, and then it becomes a problem, especially if not only are we putting it in our bodies, but we're abusively putting it into our body. So, what are substances? First of all, definition: any chemical that alters a person's physical or mental state for this purpose. Now, there are other substances as well that doctors use for other things, but we're going to be covering substances that lead to addiction. So again, what are substances? Any chemical that alters or a person's physical or mental state. Examples: alcohol, tobacco, prescription medications, illegal substances like marijuana, cocaine, heroin, opioids. And then there are other types of substances, inhalants, hallucinogens, pretty much anything that is a drug that alters the state of the body. Some of the things that may not be covered here are other things that people get addicted to. And it can be pretty much any type of, and in this sense, we're talking about substances. So these are some of the substances that are used, and we use these abusively. And really, we have to talk about what does abuse mean? Well, abuse means is that they're used for an intention that they were not initially intended to be used for. So here we're going to take a look at the types of substance use. Again, getting back to the point, substances in and of themselves are pretty much nothing. They're inert. But these are when we start to use substances, that's when the abuse comes in. So occasional or experimental use without significant negative consequences. So if you use a substance for that reason, it's not necessarily an addiction. It's not necessarily a substance abuse. Now, we fall into substance abuse when we start to misuse the substance. So, using a substance in a way that is not intended or prescribed, or in larger amounts than recommended, can be the beginning, but still is not really substance abuse. The abuse comes in when there's continued use of a substance despite the negative consequences. Dependence, addiction. What does that mean? A chronic relapsing of a brain disease characterized by a compulsive drug seeking and use despite harmful consequences. So it becomes an addiction when it meets this criteria of dependence, and that dependence is chronic, so long term, using often despite possibly falling into negative consequences. So, when usually when people have an issue with addiction, there are some risk factors that are there that usually can be instigators in providing an environment for substance use disorders. One of those is genetics, family history of substance use disorder. So if you have a family history, you're already, for the most part, predisposed. Now, not that is to say, not in all cases are you predisposed. There are people who are born into, and my particular family is one of those families where not everybody who came out of our family had an issue with addiction, but the majority of my siblings did have an issue with addiction. And when you are born into a family where there is previous issues with addiction, parents or even possibly a sibling, then um, that can be an influencer to you. Then you're going to be more likely to use substances in an abusive way. Also, if you struggle with mental health, depression, anxiety, trauma, a lot of times people who struggle with these things will turn to substance abuse to help them to get through these feelings of depression, feelings of being anxious, and trauma, which a lot of times trauma has the ability to just throw us into a spin in our lives, and we look for some way to solve that. And drugs come along as a seemingly good alternative because at least we don't have to feel that way anymore. But the problem with drugs is that they really never really take away the feeling. They only mask it for a period of time while destroying your body. And then the feeling will eventually come back again. So it's good for us to get help from people who are professionals at helping people with depression or anxiety or previous trauma. And then there are also social factors, peer pressure, easy access to the substances, poverty, which can also, when you're in a poverty state or when you're poor, you look for ways to get out of it. You don't want to be poor, but you can't get out of it. And I came from that background too. And so when you can't get out of it, you look for ways at least to feel different about your surroundings than what you're experiencing. So, and that's really where drugs really sell it, is that they sell you the ability to get out of your current state. Factors for substance use as well. As we were talking about before, a family history of substance use disorders, you can be predisposed. It's not 100%, but it does set you up for being predisposed to substance use disorders. If you struggle with mental health issues, depression, anxiety, trauma, as we talked about previously, then you can also be set up for substance use disorders, as well as social factors, peer pressure, easy access to substances, poverty, trauma, as we talked about before. But peer pressure is something that usually in our earlier ages, teenage years, we are influenced by a group maybe that we're following. Maybe it might even be one person, might even be a boyfriend or a girlfriend. But peer pressure comes along and says, "Hey, man, why don't you just try this out? Why don't you just try this? It's going to make you feel better." And we try it one time, and it becomes a major stumbling block for the rest of our lives. So peer pressure can bring along a desire for substance use, as well as if it's just easy access, if it's right there in front of you, you're smelling it, you're looking at it, then the chances of you using it as it's there and you're not feeling good yourself, and it's an alternative to feeling differently, you can be in a situation where you're going to be more likely to use. So now that we've talked about some of the predispositions and the environment basically that we can be in, that's going to make us more likely to use. What now are the effects of using? I mean, once I use, then it's not just the temporary high that we get, but also what does it do to our bodies? How does it affect us? There are short-term effects to substance use. Short-term effects can be impaired coordination, slowed reaction time, increased heart rate and blood pressure, nausea and vomiting. And different drugs will bring about different physical reactions. You may have a higher heart rate and your blood pressure will go up if methamphetamines is something that you use. You can have impaired coordination if you're an alcoholic, and you can get dizzy and sometimes even if it's serious enough, just pass out. A side effect also can be mental impairment or mental uh, loss of mental judgment, proper judgment, altered perception, mood swings, anxiety, paranoia. And some of the drugs that we use bring about these things. And this is really what makes it uh, so difficult to when we use is that we think that we're using, and there's not we're doing ourselves uh, something better than what we were before. In reality, drugs come along and they provide a temporary fix to our emotional state or our mental state, only to leave us hanging with a worse state than what we were in before. And then, of course, we have the behavioral aspect too, where certain drugs will make us do things that we would not normally do. We might be more aggressive. We might be more loose and partake in risky sexual behavior. And of course, like many state laws say that if you're caught driving impaired, then you get fined for that. You can go to court for that and even go to jail for that. So there are consequences to substance use abuse. So we talked in the previous slide about some of the short-term effects, but what about the long-term effects of substance use and really substance abuse? Long-term effects of substance abuse can have serious consequences as far as damaging your liver, your heart, your lungs. It can increase your risk of getting cancer. It can also weaken the immune system. Of course, if you weaken the immune system, then you're going to be at risk not only for cancer, but for a number of different physical issues. And then overdose. I know people who have overdosed several times and have been lucky enough to make it through. I also know people who have overdosed and they're no longer with us today. So these are, physically speaking, long-term use can have serious consequences just on our physical bodies. As far as our mental state, sometimes you may start off not really having any issues with depression or anxiety or psychosis or dementia, but after long-term use, you're setting yourself up for, and those who use are setting themselves up for struggling with these things simply because of the drug use. They may not have even started out feeling that way, but now they have issues with these types of mental uh, issues. As far as relationships, many people who use will cause their relationships to end prematurely, or at least cause a lot of problems in their relationships. Job loss, a lot of jobs are not going to have anyone show up either high or get high on the job. You're going to get fired. Legal issues, homelessness. Homelessness, simply because people have chosen to use more than they've chosen to want to invest in their life. So, where the money should have gone for rent or should have gone for housing, instead it's gone for the drug. And a number of people have been than willing to lose their house in order to maintain the drug. The area that's most significantly, if we could say that, that's affected by drug abuse is the brain. The brain is hijacked, basically. Hijacked is taken over by the drug. There are levels of dopamine that are influenced by a drug, depending upon the drug that you're using. And what the dopamine does is it goes into the brain and then it tells the brain that you're getting so much dopamine, too much dopamine, and then your brain begins to react by making adjustments. But those adjustments are not necessarily made, those adjustments are just basically made to preserve the brain so it can stay in existence because the drugs are taking over and damaging the brain, and the drugs are also increasing the levels of dopamine so much that the brain has to try to correct those levels of dopamine. So, how do substances affect the brain? They alter the brain's chemistry. They disrupt the communication pathways, and they impair decision making. Again, many of you know that after use for some time, you lose the ability to concentrate like you used to be able to concentrate. You lose the ability to remember like you used to be able to remember. Um, Addiction is a brain disease, basically. Changes in the brain structure and function can persist long after a person stops using. And there's data out there that would support the fact that it takes um, a year and a half to 2 years before the brain can come back and be uh, pretty much back to the state that it was before drug use. But there's things you have to do with that too. You would have to exercise, eat properly, and not use mainly for that period of time before your brain can at least be almost, if not back to the way it was before. That's before drug use. So there's some signs of substance use, changes in your behavior, physical signs, changes in relationships. All of them are, these are negative signs: increased secrecy, mood swings, irritability, changes in sleep patterns, you have red eyes, changes in appetite. Isolation keeps you away from your relationships, and of course, damaged relationships. So these are signs that not only are you using, but now this using has turned into a full-blown addiction. The most important thing is that if someone is suspect of a drug addiction, the abuse of drugs, they need to get help. It's not going to go away um, just by itself. You're going to need to get help. So here's a few resources that you can use to get help from substance abuse, substance addiction. Uh, Talk to your healthcare provider. Talk to a therapist or counselor. Get into support groups. I can't say enough about Alcoholics Anonymous, Narcotics Anonymous. These groups are phenomenal groups that can change the life of an addict and get them out of their addiction. Um, Bill Wilson and Dr. Bob and some of the other people who started these groups, they still exist today because they've been effective. So if you know of someone or if you're caught in an addiction, these groups would be very important in order to get healing, to be set free from addiction. And also, there's the hotlines, there's helpline, there's a lot of help out there. It's just a matter of just wanting to make that call, make that connection. Now, if there's an addiction or you know someone who has an addiction, all hope is not lost. Not only are there resources that you connect with, but also there are some treatment options. Medications can help to reduce cravings. Medications can help with withdrawal symptoms. A lot of times, if people are afraid of the withdrawal system, for instance, let's say that you do have an addiction. When you determine that you're going to stop using, your body's going to respond not the way you want to respond. You're going to feel uncomfortable. You can get sweats, start throwing up, get very tired. These are signs that you have an addiction. So a lot of times people would just rather go back to the drug as opposed to get away from an addiction. So there are things like medications that are out there that will help to get off of these drugs. Then there's therapy for our mental stability, cognitive behavioral therapy, motivational interviewing, family therapy, and then there's rehabilitation programs. For instance, OneSource, that is an inpatient and outpatient program where people can come, they can become part of the groups, they can receive medication and get the help that they need so they no longer need to struggle with their addiction. So there's also ways to prevent if you have used drugs, but maybe it's not an addiction yet, which it can very easily turn to addiction. But if it's not an addiction yet, then there are some prevention strategies to help with it not becoming an addiction. So number one, get educated. Uh, Teach yourself and others about the risks of substance use, especially if you have teenage kids. Um, it's it's shown that the likelihood of there being permanent damage, or at least long-term damage, I wouldn't say permanent, but long-term damage from the use of drugs and alcohol go up the earlier on that someone begins to use substances in an abusive way. Later on in life, even though it can hinder your physical and mental capacities later on in life, it's not as severe as if it is something that has been used at early on, 14, 15, 16 years old. So early intervention is crucial. Identify and address the risk factors. If there's emotional trauma, if there's trauma that's happened in the school system or even other types of trauma, then that is a risk factor environment for drug abuse. Not saying everybody will use, but it can be an environment where drug abuse can occur. Also, a strategy for not using drugs abusively is building a resilience. Develop coping skills and healthy social connections other than environments where people use drugs abusively or alcohol abusively. Also, and alcohol is a drug, so using alcohol abusively as well. And also reduce the access to substances. So limit your availability. If you're going to be around people who you know use all the time, probably be good not to be around those people and find yourself another peer group that reinforces good behavior. So you may be one of the ones that have heard this before. Now you decide that you wanna work on your addiction. You don't want to be addicted anymore. And there are a few discouraging things that will come along to keep you in your addiction, and that is stigma of your um, addiction, and the way people view it may keep you just in isolation because you don't want to come out and reveal that you have an addiction, because of the way people respond to it. So understanding and combating stigma is important. Substance use disorders are medical conditions. They're not moral failings. And so you can have great moral standards and yet be failing in this substance use disorder because of your physical addiction to substances. So that stigma, hopefully you can be around people, and usually people in the recovery environment are not going to be giving you the feeling that you've been stigmatized from the people around you. Also, creating a more accepting and understanding environment is important for yourself when you're around recovery, and that's why recovery groups are crucial for anyone that's going to be able to recover for long term from drug addiction. So, if you know of someone who has trouble with addiction, or even yourself, there are organizations and places you can go that will be hubs for communication and hubs for resources to help with addiction. And that's through SAMHSA, Substance Abuse and Mental Health Services, uh, NIDA, National Institute on Drug Abuse, and also your local community health centers, and also CSBs are a good resource for helping with substance use addictions. So thank you for watching this presentation. Hopefully you found some information that can be helpful either for your journey or for someone that you know who has issues with drug addiction. This last statement here, I choose sober because I wanted a better life. I stay sober because I got one. When you choose a sober life, you will get a better life. Thank you very much.